Doctors gave up fixing this yoga girl's back pain, but in less than an hour, she's doing the downward dog again after helping hundreds of people who suffer from lower back pain and battling it myself when I was younger. Can you tell there's probably no more aggravating form of pain? Sometimes you can't sit. Sometimes you can't stand. Sometimes you can't walk or drive. Or lie in bed. Or even twist your neck. The pain is simply wretched. A couple days ago, someone came into our clinic on her hands and knees. It was the only way she could find relief. She was in tears. The pain radiating down her legs was unbearable. She actually inspired today's article. Today I'm going to tell you what I told her. Every week, in fact, my clinics and programs are a destination for people from all walks of life who suffer from back pain. The first thing you should appreciate is back pain is not your main problem. That's right. Allow me to be clear about this, because it's important. Back pain is not a diagnosis. If you're seeing a doctor and they're telling you that's what you have, you're not being told the whole truth. I have doctors who are in pain visit my clinics, so I know. Let's put it this way. Back pain is a symptom. The doctor is only labeling a symptom. They're not telling you what is actually wrong. Now when they put a label your pain, I totally get how good that makes you feel in the moment. What happens next? They prescribe some heavy-duty ibuprofen to calm the inflammation, maybe ship you off to a physical therapist, and then they're on to the next patient. And you already know how that works, don't we? Let's face it. The reality is a lot of doctors fail to fix their back pain patients. They return repeatedly with the same pain, the same issue, the same cry for help. The doctor eventually begins to wonder whether the patient even wants to get better. Imagine that. It doesn't quite occur to them it could be the treatment that's not working. And that's because their back pain diagnosis just becomes an easy way of sending the patient home happy. For the record, any number of things can be the true cause of your back pain. A disc irritating, compressing or pinching a nerve. A facet joint at the back of a vertebra which is out of alignment. A strained back muscle spasming and painfully squeezing a nearby nerve or nerve sheath. Multiply these issues by the number of vertebrae and muscles in the back and you can appreciate how much work it can be to accurately diagnose the root problem. Even with technology like MRIs. Which is why most doctors feel they're doing the best they can with the resources available. That's why I prefer to take a more self-directed, holistic approach to fixing back pain. So how do we fix the pain and stiffness? Recently, a successful yoga instructor came to my clinic and, even after decades of yoga, for some reason, she still suffered with back pain. I don't know about you, but I was under the impression that yoga instructors and their active, stretch-filled, muscle-focused, posture-perfect lifestyle would be the last people on earth to experience back pain. Actually, I was rather shocked. Instead, we wake up certain muscles and restore muscle balance. That's key. Yes, there are ways to get out of pain. They don't require medication, surgery or injections. They don't require months of physiotherapy. You just have to restore your body's natural functional movement and muscle balance and allow it to heal naturally.